There is a range of medications under the category, but there is only one which you take as a tablet or capsule. We will talk about that too in this video. Also, we are going to talk about which ones are the better ones for weight loss and diabetes control. GLP-1 receptor agonists are a class of medications used primarily in the management of type 2 diabetes and, more recently, for weight management. Alongside Wegovy or semaglutide, several other GLP-1 receptor agonists are available on the market. These medications share similar mechanisms of action but may vary in terms of dosing, administration, and side effect profiles. Some of the notable GLP-1 receptor agonists include Number 1, liraglutide or Victoza, and Saxenda. Liraglutide was one of the first GLP-1 receptor agonists approved for the treatment of type 2 diabetes. It works by stimulating insulin secretion, inhibiting glucagon secretion, and slowing gastric emptying. In addition to its diabetes indication, liraglutide is also available under the brand name Saxenda for weight management. Saxenda is approved for use in individuals with a BMI or body mass index of 30 or greater, or in those with a BMI of 27 or greater who have at least one weight-related comorbidity. Disclaimer: consult your health care professional before making any changes to your medication or lifestyle. Number 2, exenatide, sold as Byetta, or Bydureon. Exenatide is available in two formulations: Byetta, which is administered as a subcutaneous injection twice daily before meals, and Bydureon, a long-acting formulation administered once weekly. Like other GLP-1 receptor agonists, exenatide helps regulate blood sugar levels by stimulating insulin secretion and suppressing glucagon release. It may also contribute to weight loss and has been shown to improve cardiovascular outcomes in some studies. Number 3, dulaglutide or Trulicity. Dulaglutide is a once-weekly injectable medication approved for the treatment of type 2 diabetes. It shares similar mechanisms of action with other GLP-1 receptor agonists, including enhancing insulin secretion and suppressing glucagon release. Dulaglutide has been associated with weight loss and improvements in cardiovascular risk factors. Number 4, lixasenatide or Adlixin. Lixasenatide is a GLP-1 receptor agonist administered as a once-daily injection. It is indicated for the treatment of type 2 diabetes and works by stimulating insulin secretion and slowing gastric emptying. While weight loss is a common side effect of lixasenatide, its cardiovascular effects have been studied to a lesser extent compared to some other GLP-1 receptor agonists. Wait, there is more. But do not forget to hit the like button and subscribe, down below. Number 5, semaglutide or Ozempic. Before being approved as Wegovy for weight management, it was available under the brand name Ozempic for the treatment of type 2 diabetes. Like other GLP-1 receptor agonists, semaglutide helps regulate blood sugar levels and has been associated with weight loss. The dosage for Ozempic differs from that of Wegovy, with Ozempic typically administered once weekly. There is currently only one FDA-approved GLP-1 agonist tablet. Rybelsus is a semaglutide tablet. It is prescribed for type 2 diabetes management. Some doctors may prescribe Rybelsus off-label for weight loss in patients with obesity, but it's important to discuss this with a medical professional first. This oral formulation of semaglutide was developed to provide a more convenient option for individuals who prefer oral medications over injections. It is designed to withstand degradation by stomach acids and enzymes, allowing for absorption in the intestines while still maintaining its therapeutic effects on blood sugar control and weight management. The oral semaglutide tablet has been studied extensively in clinical trials for the treatment of type 2 diabetes, demonstrating comparable efficacy to the injectable form of semaglutide, Ozempic. Additionally, research has explored its potential benefits in other areas, including cardiovascular outcomes and weight loss. However, it's important to note that the oral formulation of semaglutide was not specifically developed or approved for weight management like Wegovy, which is injectable semaglutide. Instead, its primary indication is for the treatment of type 2 diabetes. Nonetheless, its effects on weight loss observed in clinical trials may have implications for individuals with both diabetes and obesity. These GLP-1 receptor agonists offer valuable options for individuals with type 2 diabetes who require additional glycemic control and may benefit from weight loss. Additionally, the approval of Wegovy expands the armamentarium for healthcare providers in addressing obesity and its associated comorbidities. It's worth mentioning that the availability of oral GLP-1 receptor agonists may vary depending on regulatory approvals in different countries. As research in this area continues to advance, there may be additional oral formulations of GLP-1 receptor agonists introduced to the market in the future, providing more options for individuals seeking alternatives to injectable medications. Which GLP-1 agonist medication is the best for weight loss? Two GLP-1 agonist medications are currently FDA approved for weight loss in the United States. Liraglutide Saxenda. This medication comes in a pre-filled pen for daily injections. It works by increasing satiety, feeling full, and reducing appetite. Semaglutide Wegovy. This medication is also administered via a pre-filled pen for weekly injections. Similar to liraglutide, it promotes satiety and reduces appetite. Choosing between the two depends on several factors, including your individual needs and preferences. Liraglutide requires daily injections, while semaglutide is a weekly injection. Your insurance coverage, if you have any. GLP-1 agonists can be expensive, and coverage may vary depending on your insurance plan. Your medical history. Certain medical conditions may make one medication more suitable than the other. It's important to consult with a doctor to determine if a GLP-1 agonist medication is right for you and which one would be the most suitable option. They can consider your individual needs and medical history to make the best recommendation. Which one is the best for diabetes? There isn't a single best GLP-1 agonist medication for diabetes, as each has its strengths and may be a better fit depending on the specific needs of the patient. Here's a breakdown of some factors to consider. Blood sugar control. Recent studies suggest tirzepatide Mounjaro might be the most effective for lowering HbA1c blood sugar control compared to other GLP-1 agonists. You may have to discuss other alternatives like SGLT2 alternative with your doctor. Up above you see a video about SGLT2 medication. They are most likely cheaper and easier as they are tablets. Also, some of them have multiple benefits for heart and kidney protection. Additionally, while GLP-1 agonists can be a helpful tool for weight loss, they are not a magic bullet. They should be used in conjunction with a healthy diet and exercise program for optimal results. However, it's essential for individuals to discuss with their healthcare provider to determine the most suitable treatment option based on their specific needs, medical history, and treatment goals. Do not forget to click the like button and subscribe. Up above you see videos related to other diabetes medication. It will be more helpful to you and your family. Subscribe to my channel. See you in the next video.